Colorectal cancer. Get screened. What is colorectal cancer? First, let's take a look at where colorectal cancer begins. Cancer is a disease where cells in the body grow out of control. Cancer is always named for the part of the body where it starts, even if it spreads to other parts later. Colorectal cancer starts in either the colon or the rectum. The colon and rectum are where stool is stored until it leaves the body. So how does a person get colorectal cancer? Everyone is at risk for colorectal cancer, but several factors can increase that risk. Some of them you can control, and some of them you cannot. The following are risk factors that a person cannot control. Age. Colorectal cancer happens most often in individuals aged 50 or older. The risk of getting colorectal cancer increases with age and is greater in men than in women. About 9 out of 10 people diagnosed with colorectal cancer are at least 50 years old. Personal and family history. Colorectal cancer may run in some families. If you or someone in your immediate family has had either colorectal cancer or colorectal polyps or chronic colitis, your chance of developing the disease is doubled. There are other risk factors that you can control, which help lower your risk of colorectal cancer. Diet. Individuals whose diets are high in fiber, vegetables, and fruits may lower their risk for colorectal cancer. Diets high in fat and low in fiber raise the risk of colorectal cancer. Physical inactivity. Lack of regular physical activity can raise the risk of developing colorectal cancer. Men and women who are regularly active are seen to lower their risk of colorectal cancer by 30% to 40%. This lowered risk is seen no matter how much the person weighs. Regular physical activity can include walking briskly for 30 to 60 minutes every day. Alcohol. Colorectal cancer has been linked to heavy drinking of alcohol. Alcoholic drinks should be limited to no more than 2 drinks a day for men and 1 drink a day for women. Smoking. Smoking is a well-known cause of lung cancer, but it is also linked to colorectal cancer. Long-term smokers are more likely than non-smokers to develop colorectal cancer. It is important to remember to get screened regularly, especially for those aged 50 and older. Your healthcare provider may offer the following 4 screening tests. The fecal occult blood test, or FOBT, is one method of screening. It is simple and easy. It can be done at home. The FOBT test uses samples of your stool on a special card to look for any unusual changes in your colorectal cells. This card is sent to a lab for analysis. The fecal immunochemical test, or FIT, is another method of screening that can be done at home. This method is more commonly used to look for any abnormalities. Your stool samples are placed on a special card and checked for hidden blood. Blood in the stool can mean polyps or cancer, and more testing may be needed. Colonoscopy. For this test, the doctor looks at the entire length of the colon and rectum with the colonoscope. The colonoscope is a long flexible tube with a camera and light on the end. It's inserted through the rectum into the colon so the doctor can see and remove any suspicious looking areas such as polyps. Sigmoidoscopy. This test is similar to the colonoscopy, except it only looks at the lower third of the colon. During this test, the doctor uses his sigmoidoscope, a shorter version of the colonoscope. Screening guidelines. According to American Cancer Society, it is important to get screened regularly. The following are guidelines for each screening method. For the FOBT test or the FIT test, the American Cancer Society, or ACS, recommends using either of these screening tests every 12 months. The FOBT and FIT test can be used interchangeably. Sigmoidoscopy. The ACS recommends having a sigmoidoscopy every 5 years. Colonoscopy. A colonoscopy is recommended every 10 years. You can take action to lower your risk of colorectal cancer by remembering these key points. Don't smoke. Limit your alcohol intake. Eat healthy. Exercise regularly. And keep a healthy weight. Ask your doctor for advice on eating healthy and exercising regularly, as these will help you to maintain a healthy weight. So what are you waiting for? Get screened. Taking care of your health and protecting yourself with regular screening has benefits for your life and for your loved ones around you. Call the Charles B. Wang Community Health Center at 212-966-0228 or visit your doctor today to find out how you can receive your colorectal cancer screening kit or schedule a test with partnering providers.